We're here today for the Sex and Sexuality After Cancer conference. The aim of today's conference is to provide a safe and supportive environment for health professionals to be able to have some difficult conversations with regards to sex and sexuality after cancer.
We've brought together a load of healthcare professionals from across Staffordshire just to get people into the room together and start having the conversations that people aren't talking about.
We've been talking about the importance of sex and sexuality to everybody, and actually if you've had a diagnosis of cancer, it's important that staff are able to support everybody's sex and sexuality, whether you're LGBT, whatever type of sex acts you enjoy and where you get fulfilment, and making sure that staff are equipped to be able to support people. We create these normals in society that we impose on other people rather than just valuing people's own lives and what they enjoy themselves. So the conference is really about trying to make sure that people aren't shocked, making sure that they feel that this isn't something that they process in front of a patient, that they're aware that sex is diverse and as diverse as humanity.
It's important that we have days like today so that the healthcare practitioners have hopefully good information, have a chance to look at different terminology, different language, what that then means to their individual people's lives and how that's impacted on them with their cancer.
Very good in the sense that they were giving, not just sharing people's experiences, but while I was sitting there I was looking at how do I relate this to the wider health and social care in practices that we have to implement as healthcare organisations.
I found it kind of backed up some of the things that we've already tried to include in our practice, but then also it's good just to have a bit of a challenge sometimes and just a reminder really of what we should be trying to do to kind of like include people and be sort of reflective in the way we work with people.
Broadening your own horizons and knowing how much of an impact cancer treatments can have on people and just being able to take that away and not afraid to ask the questions and just accepting people for who they are and just ensuring that we're delivering person-centred care and everything.
It's a huge taboo for us. We're very British when it comes to talking about sex, and I think if we can just open the door a little bit, start having the conversations, it can only lead to positive things.
We're all very aware of the impacts our mental health and mental functioning has on our physiology. We all know as well that we're in times of austerity where we're asking public services, just like everybody else, to do more for less. And what we're hoping is today, by raising the awareness of how all of these issues are very, very connected, we can help practitioners to support patients to remain within productive, healthy relationships which will better support them, better serve them. We all know that as families, as communities, we are better together. So really that's the main aim, is just really promoting health as much as we can.